Presentation is on conflict resolution and its influence on nursing collaboration and professionalism in the workplace. Presented by Colleen St. Thomas, Jasmine Ellis, Kim Gisser, Amanda Hall, and Chelsea Dunn. Nurses and stress, a tale as old as time. Stress for nurses in the healthcare workplace is inevitable by the very nature of the profession. This stress, while being a positive force in some situations, can just as easily become a negative force that ends in conflict between nursing staff. Common issues we see in the workplace that cause increases in stress and conflict include communication issues, high-stress work environment, leadership issues, inadequate training, bullying and harassment, it's physically demanding, and personality differences. Implications of conflict. Conflict can cost an organization billions per year, with an average of 3.3 hours per week lost trying to resolve issues between employees. Nurses will reduce their hours at work because of conflict with their coworkers. Studies have found that nurses identify their managers and nursing colleagues as the most common source of conflict, and conflict with nursing colleagues as the most stressful type. Unresolved conflict results in work disruption, poor work performance, tardiness and absenteeism, low staff morale, low staff motivation, increased psychological distress and burnout, and it can affect the overall productivity. Conflicts between nurses, whether an acute episode or chronic issue, lead to the same result: a breakdown in professionalism and collaboration among nursing staff, which inevitably causes increased stress, tension, and unhappiness among staff, and will ultimately lead to future conflicts. The solution: conflict resolution. Since some conflict situations can be unavoidable for nurses, such as disagreements and direct care decisions for critically ill patients, it is imperative that nursing staff learn effective conflict resolution techniques and styles to come to the best solution while also preserving and promoting positive relationships between all healthcare professionals. This presentation explores how proper conflict resolution strategies can improve collaboration and professionalism among nursing staff by helping to decrease stress and improve job satisfaction.
All right, stakeholders in the game. Who are people that are most affected by conflict and conflict resolution? Well, it's going to be nurses, obviously, RNs and LPNs alike, medical technicians and aides, physicians, mid-level providers, ancillary healthcare professionals, management, and most importantly, the patients. Remember, a nurse's ability to solve conflicts in the workplace can directly and indirectly impact patient care. So what is conflict resolution and what purpose does it hold for nurses? So it's a process that aims to mediate and resolve a discrepancy between two parties that will end in a solution that both parties can agree on. When conflict resolution is performed in a positive manner, it involves open communication to clarify issues and exchange information, acknowledging and correctly interpreting the other party's concerns, needs, and emotions, and reaching the best possible solution for both parties. When implemented correctly, conflict resolution should result in an increase in positive communication flow, an improvement in trust and promote collaboration among nursing staff, elevate a sense of professionalism within the healthcare team, de-escalate the potential conflicts or conflicts in early stages, decrease workplace stress, and promote better patient care and outcomes. There are 5 basic conflict resolution styles based on the Thomas Kilmann conflict model. There is integrating, which is also known as collaborating, that aims to find a solution that is agreeable to both parties, where they don't have to give anything up. Avoiding, which is where one or both parties simply ignores or evades the issue at hand and does not resolve the conflict, really. Obliging, which is also known as accommodating, finds commonalities between both parties as a foundation for finding a solution, but typically favors one party. Compromising, where both parties give up something in exchange for a solution. And dominating, where one party has concerns and needs that are met at the expense of the other. So which styles are better for nurses? There are the agreeable conflict resolution styles, which are integrating, obliging, and compromising, because these promote open communication and teamwork with the idea of having a mutually beneficial and agreed upon resolution. Non-agreeable conflict resolution styles are dominating and avoiding, as these can set the stage for negative feelings by both parties. They can limit communication among nursing staff. They can increase stress levels and staffing issues. Conflict resolution styles that are chosen by nursing staff are typically influenced by the root cause of the conflict, individual personalities and cultures, and the level of emergency of the conflict. These factors should be considered when resolving workplace disputes, and also in which conflict resolution strategies are taught and how they should be presented.
So what's the nurse's role? Trust the process. Positive, reinforced communication is essential for good nursing leadership and management of conflict. As a healthcare professional, nurses need to engage in open and meaningful communication and listening when presented with conflict situations. This will assist them in attempting to mediate conflicts by themselves initially. Ineffective communication can lead to problems when trying to dispute a conflict, so it is essential that the nurse knows how to de-escalate tension at any time while maintaining the integrity of the team and advocating properly. Nurses do not just communicate with other nurses. They have to be able to adapt their communication skills in order to communicate and collaborate effectively with the patient and their caretakers, as well as other multidisciplinary staff members. Proven communication strategies equals desired results. So since communication is the interactive sharing of information, it requires a sender, a message, and a receiver. This process is called encoding and decoding. The sender needs to be able to effectively convey the information and overall message that they want to be heard and understood. The receiver has the responsibility to listen to, process, and understand the information, and then respond to the sender by giving feedback. Sender error can also be in relation to unclear speech, monotone voice, poor sentence structure, inappropriate use of terminology or jargon, lack of knowledge about the topic. On the other end, the receiver error could be in relation to lack of attention, prejudice and bias, preoccupation with another problem, and physical factors such as pain, drowsiness, or impairment of the senses. Develop superior conflict resolution skill sets for nurses. Nurses need to build on individualized existing skills to enhance what each member brings to the table. You want to avoid personal attacks and listen actively, set the stage, and most important of all of them is to establish that trust. Be real. Creating the lasting trust is the foundation that sets the stage. Building and maintaining the good rapport will strengthen even a once fragile infrastructure within the workplace. So know when to reach out for assistance from other resources, such as other professionals within the healthcare team, administration, if the conflict cannot be readily resolved, of course. Remember that nursing managers have a large hand in dealing with conflicts and attend classes specially geared towards conflict resolution and communication techniques.
What does the research show? When it comes to the effectiveness and agreeable versus non-agreeable conflict resolution styles, several studies reached these results. Almost found that those using an agreeable style of conflict management are more likely to integrate one another's ideas through collaboration and try to satisfy the expectations of everyone, which makes their work environment less conflict-laden over time. Individuals who use a disagreeable style are more likely to avoid the conflict altogether, or they focus on having only their own ideas and needs met, resulting in an unpleasant and strained atmosphere. Almost also reported that how the individual manages conflict only partially mediated the relationship between conflict and job satisfaction, with little impact on job stress. This suggests that an agreeable style of conflict management is not enough to completely prevent the negative effects of relationship conflict on work stress and job satisfaction. However, if individuals' perceived core self-evaluation directly influence their levels of job stress, suggesting that an individual's core self-evaluation may be more effective in reducing their stress level than their ability to manage relationship conflict. A supportive work environment is an important piece that contributes to agreeable conflict resolution solutions for both the employee and the organization, and thereby reduces levels of work stress. What does the research show? When it comes to nurses' utilization in response to different conflict resolution styles, after analyzing over a dozen separate studies on the topic of nurse conflict resolution, LeBrog found that U.S. female nurses had the largest preference of using the accommodating style as compared to other conflict management styles. However, the integration method is shown to be associated with higher job satisfaction rates and positive work relationships than the other two agreeable styles. LeBrag also noted that after analyzing one study in the U.S., that using non-agreeable styles was associated with higher burnout rates, and that nurses with low morale were prone to using non-agreeable styles. In contrast, Johansson found that while there was a significant relationship between using the avoidant conflict resolution style and increased work stress, more than 25% of emergency nurses that participated in their study reported the use of avoidance styles most often, increasing their own stress. Over half of the other ED nurses in Johansson's study reported favoring the integrating and obligating styles instead of non-agreeable ones. Conflict resolution among nurses was impeded when individuals thought their concerns were devalued or not included in decision-making processes. What does the research show? The willingness to collaborate also has influence over conflict resolution. Collaboration among healthcare professionals occurs when multiple specialists work together for the betterment of the patients. In order to improve collaboration in the face of conflict, we need to confront the issue in the workplace, be able to manage the issues professionally, have early identification of potential conflicts, be able to utilize appropriate conflict resolution strategies, and keep the environment safe for all employees. Researchers at WHO have found that healthcare workers who are team players are the ones who succeed in dealing with extreme complex issues. When healthcare professionals work together with open minds, they find a greater appreciation for the people on their team. Overall, agreeable conflict resolution styles have an overall positive impact on nurses' well-being, collaboration efforts, and job satisfaction, with varying results on whether it can decrease stress for all nurses. A supportive environment and actively sensitive managers are also key to ensuring that agreeable styles are utilized and achieve productive solutions. Remember, a truly great team is difficult to find, hard to part with, and never forgotten.
So what's the problem? We can't plan a solution without identifying the problem. A common situation that causes conflict is when nurses feel overworked or overwhelmed by their assignments, such as, why isn't anyone helping me? The development of structures fostering collaborative relationships and equal input into decisions is important. Educational programs on conflict resolution strategies with practice opportunities, sharing of experiences, role-playing, learning how to manage difficult people, and practicing reflective listening increase managers' ability to manage stress and conflict among employees. Team building exercises to enhance team identity, improve communication, and build trust. Managers who use inspirational motivation by transmitting a clear and inspiring vision and giving purpose to work, and those using an agreeable style of conflict management are more likely to integrate on another's ideas, through collaboration and try to satisfy the expectations of everyone. How do we implement these strategies? We need to develop conflict resolution skills by building on existing skills, avoiding personal contact, avoid personal attacks, listening actively, ignore trivia, set the stage, and establish trust. Let's strategize and implement. A few ways to do this is one is to engage in dialogue. Nursing leaders and direct care nurses need to engage in dialogues to address conflict and conflict management behavior as a first step in creating a healthy work environment. Lack of communication and use of avoidance as a conflict management strategy prevents the root of the problem from being properly addressed and resolved, thus the conflict situation remains. Engage in coaching, educating nurses to learn how to effectively resolve conflict themselves. Because managers usually arrive after a dispute is in evolution, they may not have a clear understanding of the issue at hand. This can be accomplished through case scenarios and working with the education department on role-playing exercises. Identify potential conflicts. Conflicts are normal and inevitable experiences in the healthcare work environment. But they're usually predictable. Procedures and processes for identifying potential common conflicts need to be developed to transform these situations into opportunities for growth and learning. Education and training. Nurses need to be educated in the topic of conflict and conflict management strategies to address and effectively resolve conflict. Learning conflict management strategies empowers nurses to resolve conflict early and influence the work environment in which they deliver patient care. So what is the desired outcome? Overall, appropriate conflict resolution strategies can lead to an improvement in nursing staff and administration collaboration and communication skills, increase professionalism in relation to nursing perception of a more positive and supportive work environment, a decrease in incidents of work stress and errors, and an increase in nurse job satisfaction. Resolving conflict is important because failure to do so can impact the quality and safety of patient care.